monitors in room 6 had been screaming for 11 minutes before anyone volunteered to go back in. Sergeant First Class Owen Taggart had already reduced one charge nurse to tears, hurled a blood pressure cuff at the wall hard enough to crack the drywall, and informed the attending physician, a man with 30 years of cardiothoracic experience, that he wouldn't know a real wound if it shook his hand and introduced itself. The morning shift at the James A. Lovell Federal Health Care Center had seen difficult veterans. They saw them every day. But Taggart was a category unto himself. Leigh Danner set down her coffee, picked up the medication tray, and walked toward room 6. She was 31 years old, unremarkable in appearance in the way that people who have learned to move quietly through the world often are. Medium height, dark auburn hair pulled into a low knot at the base of her neck, a pair of scuffed white neeks that had seen better years. She had transferred to the FHCC's surgical recovery ward 8 months ago from a county trauma center in San Antonio. And in that time, she had earned a reputation for 2 things: arriving early and never raising her voice. "You don't have to go in there," said Marcus, the charge nurse, as she passed the station. His expression was somewhere between grateful and guilty. "Draw up the morphine sulfate and get me a fresh IV kit," Leigh said without stopping. "The 14-gauge needles, not the 16. She paused outside room 6 and looked through the narrow rectangle of safety glass in the door. Owen Taggart was 58 years old and looked 10 years older, the kind of aging that happens to a body that has been detonated, reassembled, and detonated again across 3 decades of service. He sat upright in the hospital bed with the posture of a man who had decided that lying down was a form of surrender. His gray-streaked hair was cut close on the sides, longer on top, and his jaw was a hard, unrelenting line. Both of his hands were fists on the blanket. His left leg was elevated, the dressing over the surgical site already showing a faint bloom of red at the center. The room had the distinct atmosphere of something that had just barely stopped being a crisis. Leigh pushed the door open. "Get out," Taggart said. He didn't look at her. He was staring at the ceiling with the fixed, contemptuous attention of a man who found it more interesting than anyone in the room. "Good morning, Sergeant Taggart." Leigh moved to the bedside table and set the tray down with a small, efficient click. "I'm Leigh Danner. I'll be your nurse this shift. Your morphine pump ran dry about 40 minutes ago, and your surgical site needs a dressing change. I didn't ask for a nurse. I asked for the doctor. Doctor. Dr. Ashford is with a post-op patient right now. He'll be available in approximately 90 minutes. She snapped on a pair of gloves. "In the meantime, we need to address your pain levels and check the incision. Can you rate your pain on a scale of don't?" The word came out flat and cold and absolute. Taggart turned his head for the first time and looked at her. His eyes were a pale, washed-out brown, the color of creek water in a drought. "Do not ask me to rate my pain on a scale of 1 to 10. I have had both femurs shattered by an RPG in Ramadi. I have had a field surgeon remove shrapnel from my abdominal cavity with tools that belong in a mechanic's shop. I have operated for 72 hours with a hairline fracture in my wrist that nobody knew about because there was nobody left to tell. Do not insult me with a number scale." Leigh looked at him steadily. "On a scale of 1 to 10, she said, "where would you put it?" There was a long pause. 7, he said finally, through his teeth. "That's what I thought." She began peeling back the dressing tape at the edge of the bandage with slow, careful hands. "The surgical repair on your Achilles was complicated by the old shrapnel scarring in the surrounding tissue. doctor. Ashford had to work around it. It means the healing is going to take longer than a standard procedure, and you're going to be in more pain than most patients at this stage. I know what the surgery was, Taggart said. I've had 9 of them. I know. I read your chart. He made a low sound in the back of his throat that was not quite dismissal and not quite acknowledgement. He let her peel back the dressing without moving. The wound beneath was angry but clean, a long incision running up the back of the left ankle and lower calf, the sutures holding neatly. She examined it for a moment without speaking, then began the process of cleaning and redressing. You've got good suture tension, she said. No sign of infection. You're healing. Lucky me. Most people would mean that less sarcastically. Taggart turned his head and looked at her again, and this time there was something different in his expression. Not softness, not anything approaching softness, but a faint recalibration, the way a scope adjusts when the target shifts. You're not scared of me, he said. No. Why not? Everyone else on this floor apparently is. Leigh folded the used dressing and set it aside. Because you're in pain, and you're not in control of your situation, and you have spent your entire adult life being the most capable person in any room you walked into. This, she gestured briefly at the bed, the monitors, the IV lines, is not a room you're capable in. That's terrifying for someone like you. I understand that, but it doesn't terrify me. Taggart stared at her. I'm going to restart your morphine drip now, Leigh continued, reaching for the IV line. And I need you to not pull it out again. I pulled it out because it made my head cloudy. I need to be able to think. What do you need to think about? The question landed in the room and just sat there. Taggart looked away. His jaw worked once. That's not your concern. All right. She connected the line, checked the rate, set the pump. I'll be back in 2 hours to check the dressing. If you need anything before then, press the call button. I won't, I know. She stripped off her gloves. Try to sleep, Sergeant. She was almost to the door when he said it. Tell them to send someone else next time. Leigh stopped. She didn't turn around immediately. She stood with her hand 4 inches from the door handle, the fluorescent light buzzing faintly above her, the monitors beeping their slow, indifferent rhythm. Someone else, she repeated. Someone with actual military experience. Someone who understands what it means to be in this position. Not a civilian playing at nursing. She turned around then. Owen Taggart was looking at her with that pale-eyed contempt that she suspected had cowed a great many people in a great many rooms. His chin was up. His shoulders were as square as the hospital bed would allow. I'll pass that along, Leigh said. She left. In the hallway, she stood against the wall for a moment and breathed. Not because she was rattled, because she was remembering, and remembering required space. She remembered dust. She remembered the particular quality of heat that exists only in the Korangal Valley in eastern Afghanistan in August. A heat that didn't just warm you, but pressed against you, personal and insistent as a hand. She remembered the sound of a UH-60 Black Hawk coming in low over the ridgeline, the rotor wash flattening the dry grass in the LZ, and the way her hands had already been moving before it even touched down, because there was never enough time, and there was always too much blood. She folded the memory back up. She walked to the nurse's station, logged the dressing change, and got herself a cup of coffee that was terrible and drank it anyway. By afternoon, things had gotten worse. The pain medication was managing Taggart's physical discomfort adequately, but something else was moving through him, something that the morphine could not reach. Leigh could see it in the way he'd declined lunch without looking at the tray. In the way he'd turned the television on and then off again 30 seconds later. In the way he sat perfectly still in a manner that was not peace, but its deliberate, effortful imitation. When she came back for the afternoon vitals, he didn't say anything at first. Just watched her move through the room with that unnerving, tactical attention, the way men who have spent years scanning horizons for threats never quite stop scanning. "Your blood pressure is elevated," she said. "I'm aware. Are you sleeping?" "I don't sleep in hospitals." She marked it in the chart. "Have you eaten anything today?" "No, that's going to slow your recovery." "I am aware of the mechanics of human healing, Danner." She looked at him. "What happened in Fallujah, Sergeant Taggart?" The silence that followed was so complete that the blood pressure monitor seemed loud. Taggart's expression didn't change exactly, but something behind it did, the way a light dims rather than switches off. "Who told you about Fallujah?" His voice was absolutely level. That was the warning. "Your chart lists a traumatic event notation from November 2004. Fallujah. That's all it says." Leigh set the chart down on the bedside table. She pulled the visitor's chair close and sat in it. "You've declined the psych consult twice. You've been awake for." She checked the nursing notes. "At least 36 hours based on staff observations. And whatever is happening in your head right now is doing more damage to your recovery than the surgical site." "You're a nurse," Taggart said. "Not a therapist." "That's true." "Then stay in your lane. I will. But I'm also the person who's going to be sitting with you for the next 6 hours, and I have found that silence tends to be loud in rooms like this one." She settled back in the chair. "You don't have to tell me anything, but I'm not leaving." Taggart turned his head away, stared at the window. Outside, the November sky was a flat, uniformly gray that offered nothing. "2nd Battalion, 1st Marines," he said finally. His voice was different now. Not soft, never soft, but stripped of the performance of hostility. Just the sound of a man saying words out loud that had lived entirely inside him for a very long time. "2nd Battle of Fallujah. Operation Phantom Fury. We were clearing a block in the Askari district, northeast quadrant. 12 of us." He stopped. "You don't have to." Leigh began. "I gave the order to breach the 3rd building on the block," Taggart said, as if she hadn't spoken. "Standard procedure. Stack up, breach, clear. My scout, PFC Eddie Morales, 19 years old, from Corpus Christi, used to draw little soccer balls on the corner of every map he was issued. I don't know why. I never asked him why. He went in first." Taggart's hands were flat on the blanket now, pressed down hard. The building was booby-trapped, not with an IED, with a thermite device wired to the interior door. Somebody had been waiting for us to breach exactly that way. The room had gotten very still. "We lost 4 men in 60 seconds, Taggart said. "Morales, Corporal Denny Ruiz, Lance Corporal Theo Baines. A Marine from Charlie Company who'd attached to our element that morning, whose name I didn't even know yet. 4 men. His voice had developed the smallest, most controlled tremor imaginable, the kind that a man expends enormous energy to suppress. I gave the order. I sent them through that door." Leigh didn't say anything. She had learned, in years of sitting with people in rooms like this one, that sometimes the most important thing was simply to stay and not flinch. "The after-action report said the intel was solid," Taggart continued, "that the building should have been clear, that I acted within standard procedure, that the outcome was the result of enemy action and not command failure." He said the words like they were, in a language he'd never trusted. I've read that report 400 times, maybe more. I have it memorized. I can recite every sentence. It does not matter. Why not? Because I can also recite every sentence of the letters I wrote to their families." His voice didn't break. It just went very quiet. "Because I can tell you exactly what Eddie Morales' mother said to me at Arlington. She said, 'He always talked about you. He said you were the best.' She held my hands when she said it. A single breath, careful and measured. She didn't know. She didn't know it was my order that, 'Sergeant Taggart.'" He stopped. Leigh leaned forward. Her elbows were on her knees and her voice was low, and she looked directly at him, the way she had learned to look at people who needed to know they were being seen. "I need to tell you something," she said, "and I need you to actually hear it. Not to answer it, not to argue with it, just to hear it." His pale eyes were on her. She had his complete attention. "In the summer of 2011, she said, I was an Army combat medic attached to a special operations element in Kunar Province, Afghanistan. I was 23 years old, and I had been in country for 5 months, and I thought I knew what I was doing." She paused. "We were on a medevac rotation. There was an engagement in the Pech River Valley. A forward patrol element had taken casualties. We went in." She had not told this story in 4 years. She had told herself it was because there was no one to tell it to. She was beginning to suspect that was not entirely true. One of the casualties was a specialist named Aaron Webb, 22 years old, from a town outside of Boise, Idaho, so small it wasn't on most maps. He'd been hit in the upper chest, right side, pneumothorax developing fast. I performed a needle decompression in the back of the helicopter. Textbook procedure. I'd done it before. I've done it since." She looked down at her hands. "Something went wrong. I've had doctors tell me 4 different things about what went wrong. The tissue was compromised differently than it presented. There may have been a second injury I couldn't see, the angle in the moving aircraft." She stopped. "He died in the helicopter, 60 seconds after I performed the procedure that was supposed to save him." Taggart was very still. "For 2.5 years, Leigh said, I believed I killed Aaron Webb. Not because I made an error, because I made a correct, by-the-book decision that still resulted in his death. And I could not separate the two things. I could not make my brain understand that doing everything right is not a guarantee, that sometimes the outcome belongs entirely to forces you cannot control." She looked up at him. "I understand what it sounds like when someone says the report cleared you. I understand why that isn't enough. I am not telling you that it should be." Taggart said nothing. He was looking at her like she'd just done something he hadn't expected. Not a trick, not a performance, but the simple, disorienting act of being honest. "What changed?" he asked finally. Leigh considered the question. "I found out, eventually, that Aaron Webb's squad leader had filed a supplemental report. Classified initially, released about 18 months after the incident. The engagement that injured Webb had started 6 minutes earlier than our element knew about. A communications failure up the chain. He'd been bleeding internally for 20 minutes before we got the call. The pneumothorax I was treating was a secondary effect of a deeper injury that had been progressing the whole time." She exhaled. "By the time I was in that helicopter, there was nothing that was going to save him. Nothing I did, nothing I could have done. The outcome was already written before I got there." She let that sit. "I'm not saying that's your situation," she said. "I'm saying that I have lived inside what you're living inside. And I know how it distorts every single thing. I know how it makes the report feel like a lie, and the families feel like people you've betrayed. And I know that nothing I say right now is going to dissolve it. But I want you to know that I'm sitting here, and I understand the exact specific weight of what you're carrying. The heart monitor continued its patient rhythm. Owen Taggart looked at the woman in the chair beside his bed for a long moment. Then he looked away. His jaw was tight. His eyes were wet very slightly in the specific way of men who have spent decades refusing to acknowledge that they have tear ducts. "You didn't tell me you were a medic," he said. "You didn't ask." A long pause. "Where were you deployed?" "Kunar Province, Pech River Valley, Karangal area of operations," she said it simply. "The way you say the names of places that changed you. 7 months. Taggart turned to look at her fully. Phobe Blessing? Twice. Main AO was Honecker Miracle. Something moved across his face. I know guys who were at Honecker Miracle. 2011 rotation. It was a busy year up there. He let out a breath that was almost, not quite, but almost, a laugh. It was the sound of something releasing slightly, just slightly. "Why are you a floor nurse?" he asked. "After all that." "Because people need somebody to watch over them when they're most vulnerable," Leigh said. "And I'm good at it. And because I learned in a helicopter over Kunar that I can't always determine the outcome, but I can always show up and do the work. So I show up every shift." She stood, reaching for the chair to slide it back. "And because the guys who come through here, the ones like you, sometimes just need someone who isn't going to look at them like they're broken." Taggart was quiet for a moment. "I owe an apology to the nurse I made cry this morning," he said. "Her name is Sandra. She's been here 16 years, and she's excellent at her job. I'll apologize to Sandra. I'll let her know." She picked up the chart, made her notes, moved to the door. "Danner," she stopped. "Earlier," Taggart said. His voice had an effort in it that she recognized. The effort of a man with no practice at certain words finding them anyway. "When I said send someone with actual military experience." He stopped, started again. "That was wrong. I was wrong." Leigh looked at him. "You were in pain, and you were scared, and you took it out on the nearest available person," she said. "It happens. We move past it." She pushed the door open. "Danner," his voice again lower this time. "Thank you for telling me about Webb." She nodded once. "Rest," she said. "I'll check the site at 1800. She let the door close behind her. In the hallway, the hospital moved around her in its constant, low-grade controlled chaos. An orderly pushed a supply cart. 2 residents argued quietly over a tablet at the far end of the corridor. Someone's family had brought flowers that were sitting at the nurse's station waiting to be delivered. Leigh walked back to the station, logged her notes, and stood for a moment looking at nothing in particular. She thought about Aaron Webb sometimes, less than she used to. The weight of him was still there, but it had changed shape over the years. The way grief does when you stop fighting it. Not lighter, exactly, but different. Integrated, part of the architecture rather than a structural fault. She thought that maybe, in room 6, something similar was beginning for Owen Taggart. Maybe. She had learned not to count on things. You showed up, you did the work, and you let the outcome belong to forces larger than yourself. It was 3 weeks later, on a Tuesday morning that smelled of fresh snow and industrial coffee, that Leigh arrived at the start of her shift to find a small group of men standing in the lobby of the FHCC. There were 5 of them. They were dressed in civilian clothes, jeans, flannels, one in a canvas Carhartt jacket the color of faded army green, but they stood in a way that civilian clothes could not disguise. Alert, spines straight, weight balanced. eyes that moved with professional habit across every entrance and exit in the space. Owen Taggart was among them. On forearm crutches now, his recovery progressing well enough that discharge had been approved for that morning. He had stopped throwing things. He had apologized, genuinely and without qualification, to Sandra, who had been gracious about it in the specific, measured way of people who have seen a great deal and chosen to lead with generosity anyway. He had eaten every meal on his tray for the last 12 days. He had even on 2 occasions been observed by the night staff making halting and clearly effortful small talk with the patient in the adjacent room, a 24-year-old Army corporal recovering from an IED blast injury. Leigh saw the group as she came through the main doors and stopped. Taggart turned and saw her. "Danner," he said. She walked toward him. The men with him had oriented slightly, the unconscious positioning of soldiers who default to Fallujah, and she realized with a start that she recognized 2 of them. The large man with the forearm tattoo of the 2-1 Marines logo, and the white scar running from his right ear to his jaw. A shorter man beside him with a prosthetic left hand partially covered by his jacket sleeve. She had not seen them in 16 years, and, in another sense, she had never stopped seeing them. "Sergeant Taggart," she said. "These are some of my boys from 2nd Battalion," Taggart said. His voice was different from the voice she'd heard in room 6. Still hard, but the hardness was different. The hardness of something solid rather than something defending itself. Ruiz's cousin reached out to them, and he stopped. He seemed to be choosing words with unusual care. "They had some information I hadn't had before." She waited. The large man, who introduced himself as Staff Sergeant Kurt Pelham, retired, stepped forward. "We were behind your element in the Askari district that day," Pelham said. The intel that the 3rd building was clear, that came from a source that command had already flagged as compromised. The flag didn't reach your element in time. There was a failure 3 levels up the chain that put your unit in that position. He said it straightforwardly, without decoration. The way men who have processed something for a long time sometimes say it when they finally say it out loud. It wasn't in the original after action because the investigation into the intelligence failure was running concurrent and classified. The full findings were released to veterans' records in 2019. Leigh looked at Taggart. His expression was not the expression of a man who had just been told something that solved everything. It was something more complicated and more real than that. The face of someone who had been carrying a specific kind of weight for so long that even its partial lifting felt disorienting. "I didn't know until 2 weeks ago," Taggart said. "Pelham found it, drove 8 hours to tell me in person." He looked at the floor, then back up at her. "Morales, Ruiz, Baines. They went through that door because they trusted the intelligence I'd been given. The intelligence that had already been flagged as bad." His voice was low. "It doesn't give them back. I know that. But he stopped. "It changes what it means," Leigh said quietly. "Yeah," his voice was rough. "It changes what it means." She stood with them in the lobby for a moment. The 5 men and the 1 woman, and the air between them had the particular texture of people who have come through things that leave marks and learned to stand in the same space anyway. Then Pelham reached into the pocket of his canvas jacket and took out a small object. He held it out to her. It was a challenge coin, worn smooth on the edges, the finish rubbed dull in the center where it had been handled many times. On one side, the eagle, globe, and anchor of the Marine Corps. On the other, the numeral designation of 2nd Battalion, 1st Marines, and below it, in small stamped letters, Pantum Fury, NOV 2004. That was Eddie Morales's, Pelham said. His mother asked us to find someone who deserved to have it, somebody who sat with the ones who came home and helped them carry it. He looked at her steadily. Taggart told us about you. Leigh took the coin. It was heavier than it looked, the way objects that belong to the dead always are. She stood for a moment, unable to say anything that felt adequate. Taggart cleared his throat. You told me you showed up, he said, every shift, that you couldn't control the outcome, but you could do the work. His jaw was tight with the effort of the moment. That's what they did, Morales, all 4 of them. They showed up and they did the work, and the outcome didn't belong to them. He met her eyes. You said that to me when I needed to hear it. I thought maybe you needed to hear it back. The lobby was noisy. Hospitals are always noisy. But standing there with that coin in her hand and those 5 men in front of her, Leigh was aware of a quality of quiet that had nothing to do with decibels. She closed her fingers around Eddie Morales's challenge coin. Thank you, she said. The words were completely insufficient and completely true. Pelham nodded. The man with the prosthetic hand nodded. Taggart looked at her for a moment with those washed-out eyes that had stopped being cold, somewhere in the middle of the last 3 weeks. And then he gave her the smallest possible nod, the nod of someone who has said what needed to be said and considers the account settled. They left through the main doors into the white Tuesday morning. Leigh stood in the lobby for another moment. She opened her hand and looked at the coin. Then she closed it again. She had spent 4 years telling herself that the things she carried from Kunar province were weight, purely weight, the drag of the unresolvable that you learned to distribute across your body and continue moving. She had not considered that they might also be evidence of having been there, of having stayed, of having put her hands to the work in the specific dark and not run from it. She went upstairs. There were 7 patients on Ward 4 that morning, and all of them needed something, and she knew what most of them needed before she looked at the charts, because she had learned over years of early shifts and late ones, and the long ones that blur together, that what people need, most basically and most urgently, is someone who will not look at them like they are already lost. She was good at that. She started her rounds.